Okay, so this is our second half of chapter 11. Sorry, I was having a lot of distractions, so I had to stop. So hopefully you maybe needed a break too. So we'll go ahead and continue on chapter 11 and finish up fever and inflammation. Okay, so I've talked a lot about inflammation so far, and so now we'll finally get to define what inflammation is. Basically, inflammation is an innate immune response, okay, that develops when tissues are damaged, and it is an important part of the innate defenses. Okay. Inflammation, as we'll see here in just a second, causes, well, let me go back, will cause an increase in white blood cell activity. Okay, it causes some swelling. And it's going to help promote healing as well. Okay, so, and also limit pathogen spread. Okay, so like the example I gave in the last video about the man with a compromised immune system, okay, inflammation helps keep that infection localized and not spread throughout the body. Okay, so inflammation's goals, kind of alluded to those already, recruit white blood cells and others to the injured area, to also limit the spread of infection. And when there's inflammation, sorry, I'm not like sitting in the middle. When there's inflammation, that process is going to also bring delivers more oxygen and nutrients and white blood cells and so forth to that area for recovery and also to help limit the spread of that infection. Some major signs of inflammation, you guys can probably come up with some of these. Redness may or may not always occur, but could be. Pain, localized heat, not necessarily fever, but that inflamed area may be a little bit warmer than it should be. Swelling, and perhaps a loss of function. Okay, so there's some different phases involved in inflammation. It occurs in 3 different steps: vascular changes, leukocyte recruitment, and then resolution. Okay, and this diagram is going to be shown in larger detail here in just a second. Okay, so step 1, vascular changes. Okay, if you want to look ahead to this diagram while I'm talking about that, that might be helpful. It is on page 341. If you want to look at that while I'm talking about this. But do you see that blood vessel here? This blood vessel is going to become more dilated, called vasodilation. It's going to increase in diameter. It's going to become bigger, and it's going to become more permeable or leakier. And then exudate, which is actually excess fluid, is going to accumulate in the tissues, which causes the swelling and also the pain. And so fluid from inside of the capillaries is going to leak out more so than it normally would under normal circumstances. And with that, so we're having an increase in size and diameter of this blood vessel. So you're getting more blood flow, more white blood cells to that area, and you're carrying nutrients and oxygen out with that fluid. Okay, so those are the vascular changes. And these vascular changes are going to be driven by chemical messages such as histamine. Those chemicals are going to cause this blood vessel to dilate, to undergo vasodilation. Okay, I'm not going to talk about histamine and some of the others. We're going to skip through those and go on to the next phase, phase 2. And phase 2 is going to see the effects of that increased blood flow to get more leukocytes into that area. There's also going to be chemical messages recruiting those leukocytes. And that increased vessel permeability, or the leakiness of that vessel, is going to make it easier for leukocytes to squeeze out of that vessel and get into the tissue area. So if you wanted to look at this while I'm talking about it, it's on 342 of your book, or you can look on your slide there. You can see how those chemical messages, those cells are trying to leak out or sneak out of the blood vessel to get to the actual site of infection. Okay, so here's this term diapedesis. Diapedesis is where leukocytes squeeze out of a blood vessel. Okay, that's the process where those white blood cells, like macrophages, monocytes, sneak out, squeeze out of the blood vessel. Let me come right back here. Do you see this guy right here? Oops. He's squeezing out. He's kind of changing it. It is changing its shape and it's squeezing out to come over here and get to this site of infection. That's called diapedesis. Let's see. Neutrophils are the first responders, and then monocytes come next. And then they start to phagocytize those foreign invaders, phagocytize these bacteria here. Okay, so that's step 2, the recruitment phase. And then step 3 is the resolution phase that's going to tone down, it tones down inflammation. So we start to see a recovery, we start to see the infection get under control, and this kind of just basically backs off the immune response to get things back to normal. Okay, blood vessels get to going back to their normal size, chemical messages are kind of toned down, and also swelling is toned down. And that exudate, that extra fluid or the edema, is going to be then collected by the lymphatic system and can clean up anything else that's left over. Okay, so this is that resolution phase where you start to get things cleared up. This vessel, you can see, is not as big. It's not as permeable. There's not as many spaces between these. Each one of these is a single cell here, and there's not as much space in between those. And this is on 343 if you want to look at that closer. The late stage of resolution, or late part of step 3, is when wound healing really starts to get geared up. The tissues are going to be repaired. There's what's called angiogenesis, and this is the formation of new blood cells. The blood clot will dissolve. Leukocytes undergo apoptosis, which is programmed cell death. Okay, so the extra leukocytes that were called, they're not needed anymore, so they'll undergo cell death. And then during this time, you might have pus forming, which is dead tissue cells and leukocytes. And just a note here, you can see some pus here. A lot of times that pus will just be reabsorbed by the body unless you have like a huge abscess, a huge collection of pus, and then that might rupture and leave through the skin. But a lot of times this will just be reabsorbed and cleaned up by the body. Okay, so the time it takes to heal just really depends on the injury, where the injury's at, how severe it was, and so forth. Now, I would, if I were you, I would draw a line here between this and this slide, okay? Because we have what we've talked about before this slide. Everything over here is what we would consider acute inflammation. Okay, acute inflammation is helpful. That says helpful, sorry. It can limit the spread of infection. It causes nutrients, white blood cells to get delivered, and so forth. However, chronic inflammation or long periods of time where a person is experiencing inflammation is not helpful, and it's actually quite harmful. It can exacerbate, oh my gosh, make the injury worse. Can make the injury actually worse, and it can cause more damage than is necessary. So acute inflammation can be helpful. Chronic, long-term inflammation is not helpful. It's actually harmful. Okay. I know this is taking forever, but the last topic for this chapter is going to be fever. Okay. Fever is also called pyrexia. And that's where your whole system, your whole body system temperature is too high. And it's going to be caused by a pyrogen or pyrogens. And these are fever producing agents. So it could be a bacterial toxin like endotoxin from the gram negatives. Could be any number of cytokines, could be any number of things, but it is a molecule or some sort of agent that basically signals the body that there's a foreign invader. And the hypothalamus in the brain is basically the body's control center that's going to help regulate temperature and a lot of other different things. And so these signals are going to be, say there's endotoxin, okay? The hypothalamus would detect endotoxin, and it's going to reset the body's thermostat to a higher level, okay? So the hypothalamus here in the brain detects that. It's going to reset the normal temperature of 98.6, which now there's some evidence that a human body temperature is actually lower than that. But it's going to reset it to say 100 degrees Fahrenheit. And that fever will then persist until the pyrogens are gone. And then it will reset and revert back to 98.6. So think about a time that you've had a fever, right? You've had chills, you've stopped sweating. It might be 80 degrees in a room and you put on 25 blankets. Okay, those are all mechanisms in which the body tries to drive your normal temperature higher so that you can get up to that 100 degrees. Okay. So there are studies suggesting, and there are some doctors that follow along with this, that sometimes fever can be protective. Fevers can be actually good. It can cause antiviral effects, can increase phagocyte efficiency, can increase white blood cell production, It can limit growth of certain pathogens. Maybe if it gets too warm for that particular pathogen, it's not going to reproduce as effectively or metabolize as effectively. And also promote tissue repair. Okay, so there are reasons that fever is part of the immune system. It is a way that the body has developed to help protect from an invader. So in the case of a low-grade fever, okay, 99 to 100 degrees, some doctors believe that this, and researchers believe that this low-grade fever is considered, protective. It can actually be helpful. Okay, so these doctors would argue that if you have a low-grade fever, this up to 101, you should just let it run its course. So if the patient has a fever of 100.0, let the fever persist, because it's actually helping the body get rid of the pathogen in a more natural way. Some doctors don't prescribe to that line of thought, so talk to your doctor about what you should do if you have a low-grade fever. But fever is part of the body's natural defense mechanism. Okay, if the patient is uncomfortable, not resting, there are antipyretic or pyrogen fever reducing type drugs like aspirin, ibuprofen, acetaminophen, and these work by limiting the production of prostaglandins in the body that are going to help prevent that fever from occurring, or to bring that fever back down. Okay, or if a patient has a high fever, that is a serious situation. So if a fever reaches 105 and can't be brought down, that can be life-threatening, and it's an emergency, because remember we talked about enzymes, and remember that bell-shaped curve? Enzymes can work okay down at cold temperatures, and then you get to the optimal temperature here, and you get a pretty quick drop off here. Okay, if you get your body temperature over in here, your enzymes and proteins are going to start denaturing too, and you basically start cooking cells and components in your body. And a body temperature of 109 is going to be fatal. Okay, so I know there's some information, speaking of ibuprofen and bringing fevers down and things like that. I hope none of you get this whole COVID thing. But before you take a fever reducing medication, definitely check with a healthcare professional, because there is some suggestion that ibuprofen can make the COVID virus worse. I'm not all read up on that, so I don't know how much stock to put in that, but I would definitely, if you do get sick, definitely talk to someone before you start taking fever reducing medications, to make sure you're taking the right one. Okay. And then the last slide here is just some different types of fevers. You can read through these and look at these on your own, but I'm only going to focus on a couple of them. Intermittent fever, these are ones I think that you're going to come across the most and need to be the most familiar with. So an intermittent fever is one where you get a high body temperature or an elevated body temperature, and then it's going to fall to normal. High body temperature, normal. High body temperature, normal. Okay, the next one is a relapsing fever. So you have a fever, days or weeks of a normal body temperature, and then fever. Okay, so this is in the same day. This is normal, 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 fever, normal, 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 fever, normal, normal, normal. Okay, so Borrelia burgdorferi is bacteria that's transmitted by ticks that can cause a relapsing fever. Remittent fever is where body temperature fluctuates but doesn't reach normal. So it might be 102, 101, 102, 100.5, 103, 102. Okay. And then the last one I wanted to talk about is sustained fever. And that's basically where you have limited fluctuation. It's just high. It's 102 period all day long for over 24 hours. That would be a sustained fever. Okay, so that finishes up the innate immune system. Don't forget, if you haven't already, watch the 2 phagocyte videos on D2L. And also, I haven't gotten it up quite yet, but there will be a chapter 11 mastering homework that will be due on Sunday. Okay, so that finishes up that chapter. I would definitely read through this one. I know it was kind of a tricky one. But chapter 12 is going to get a little bit trickier as well. There's a lot more to it than this chapter. So make sure you're kind of reading ahead. Please, if you have any questions, if you need me to go over anything again, or just didn't understand something, please email or call with any questions. All right, so stay healthy out there, and we will talk to you again soon.